Good evening, and thank you for joining us for our virtual housing conference. We will begin our main session presentation, Living with Supports Independently, being brought to you by the Department of Behavioral Health and Developmental Services, Office of Community Housing. The session guidelines are as follows. Please use the chat box to ask questions. We will have staff monitoring the chat during the presentation. There will also be time for questions and answers at the end of the session. But we do ask that you keep your questions generalized. Specific cases can be addressed with your regional housing coordinator. All conference participants will receive an email in October or November with links to the presentation given during this main session and all breakout sessions. And we would like to remind you that this session is being recorded for future usage. The agenda for the virtual housing conference includes welcome and introductions, an explanation of what integrated independent housing is, who is included in the settlement agreement population, housing resources available for individuals in the settlement agreement population, how the housing resources can be accessed, supports in housing and where they come from, independent housing resources, and last but not least, our breakout sessions, preparing for the transition to independent housing, live-in aids and roommates, and creative housing approaches. This slide shows each of the regional housing coordinators. For Region 1, Western Virginia, we have Marie Fraticelli. Region 2, Northern Virginia, we have Jeannie Cummins Eisenhower. Region 3, Southwestern Virginia, we have Anna Bowman. Region 4, Central Virginia, we have Cherie Hilliard Jones. And Region 5, Eastern Virginia, we have Kim Rogers. You may be wondering what a regional housing coordinator is, or how a regional housing coordinator can help. Regional housing coordinators are available to provide you, your family, and your support coordinator with technical assistance to help you as you access your own home in the community. Areas where we can help include providing information about available housing resources, assisting with developing a housing action plan, assisting with submitting a DBHDS housing resource packet, assisting with locating available units to rent in the community. We can also assist with making reasonable accommodation or modification requests, or identifying resources to assist with those upfront costs associated with moving into housing, such as security and utility deposits, basic household furniture, and supplies. There are 7 core features in integrated independent housing. Under this housing model, individuals do not reside with a parent, grandparent, or guardian. Individuals live in the same type of housing as non-disabled individuals based on income. Individuals choose how they will participate in their communities. Housing is affordable. Individuals typically pay 30% of their income towards rent with a utility allowance. Housing is accessible and leased or owned by the individual. And housing is not contingent upon participation in services. In an integrated independent housing model, housing and services are accessed separately. People choose the services they will receive and decide who will provide those services in their own home. If a person is not satisfied with the services they are receiving, or simply wants to try something different, they can change service providers without needing to move. Additionally, should a person decide to move, they can keep the same service providers for their new home. Community connections are preserved, as is the sense of having a place of one's own. Before we get to the housing resources, I want to review who is considered a part of the settlement agreement population. In order to be deemed eligible as part of the settlement agreement population, individuals must be 18 years of age or older and meet one of the following categories: live in a training center, intermediate care facility, or nursing facility and meet the level of functioning for DD waiver services, or receive DD waiver services, or be on the wait list for DD waiver services. Several housing resources have been made available for individuals in the settlement agreement population. These resources include special admissions preference, housing choice vouchers, and/or public housing, the state rental assistance program, low-income housing tax credit properties, and flexible funding. We will discuss each of these resources on the next few slides. This map shows where we have resources available across the state. Take note that we've come a long way. We see lots of different colors on this map, and we've created a lot of opportunities for folks to gain access to housing resources, but we still have work to do as we do not currently have resources everywhere in the state. So where you see the white or no color, that is where we will actively work on increasing the opportunities for folks in those areas that may be interested in independent housing. A special admissions preference has been made available by 13 public housing agencies across the state for either participation in the Housing Choice Voucher or public housing programs. Some housing agencies have offered a set-aside, while others have offered a priority on their public housing wait list. The goal is simply to provide the opportunity for individuals to move from training centers, intermediate care facilities, nursing homes, group homes, and family homes to rental housing within the community. As of July 1st, 291 individuals have leased up with a Housing Choice Voucher across the state. This slide lists the public housing agencies, also known as PHAs, that have made the Special Admissions Preference Housing Choice Voucher or Public Housing Program resource available across the state. The PHAs that have created this opportunity include Harrisonburg, Alexandria, Danville, Roanoke, People Incorporated, Petersburg, Richmond, Accomack, Northampton, James City County, Franklin, Hampton, and Newport News. The balance of the state is serviced by Virginia Housing, formerly known as Virginia Housing Development Authority. So there have been vouchers made available by Virginia Housing to be used in localities where they have a Virginia Housing Voucher Administrator. DBHDS rolled out the State Rental Assistance Program, also known as SRAP, in October of 2016. When it began, we were only able to provide rental assistance in 4 localities across the state. Those localities were Northern Virginia, Chesapeake, Norfolk, and Virginia Beach. The State Rental Assistance Program was mirrored closely to the Housing Choice Voucher Program, purposefully, because we were partnering with housing agencies that already administer a Housing Choice Voucher Program. To date, we have been able to expand the State Rental Assistance Program and have partnered with 16 housing agencies, and we've been able to create 993 housing resources across the state. So SRAP now is available in 21 cities, 31 counties, and 7 towns. As of July 1st, 377 individuals have leased up via the State Rental Assistance Program. We also have several individuals that have been referred to us for participation in SRAP and are somewhere in the process towards lease up. The Office of Community Housing continues to work on expanding the State Rental Assistance Program to areas where we do not have housing resources available. This slide shows some of our partnering SRAP administrators and SRAP service areas across the state. Currently, we have SRAP administrators in the following areas: Bristol, Chesapeake, Danville, Fairfax, Hopewell, Loudoun County, Lynchburg, Norfolk, and Petersburg. As shown on the slide, the areas of service may not be limited to the area in which the administrator is located, and often includes various counties, cities, and towns. This slide is a continuation of our SRAP administrators and service areas, which includes Prince William, Rappahannock Rapidan, Region 10, Richmond, Roanoke, Valley, and Virginia Beach. Again, I've highlighted our SRAP administrators, but the service areas in which this resource is available in most cases extends beyond the administrator's location. DBHDS also works with low-income housing tax credit properties across the state that have provided a set-aside of units or a preference for eligible individuals. Depending on the property, individuals may need to participate in a rental assistance program, such as the State Rental Assistance Program or the Special Admissions Preference Housing Choice Voucher Program, or some properties may actually offer project-based rental assistance where the rental subsidy is actually tied to the unit that will be rented. As of July 1st, there are 134 properties with a leasing preference, and over 750 units will be made available to individuals in the settlement agreement population on a priority basis. Each year, additional projects are funded to develop rental properties with a leasing preference. For more information on how to access a low-income housing tax credit property, please contact your DBHDS Regional Housing Coordinator. DBHDS only accepts referrals from DD support coordinators or case managers for participation in a rental assistance program. The referral packet consists of a completed and signed DBHDS housing referral and assessment form, a housing action plan, and if the person is already living independently, a financial need form in order for DBHDS to verify that the individual is paying more than 50% of their income towards living expenses. DBHDS also prioritizes the referrals we receive. So the first priority would be for individuals that are currently residing in a training center, intermediate care facility, nursing home, or group home. The second priority is for individuals that are homeless, at risk of homelessness, at risk of abuse, at risk of neglect, or living independently but paying more than 50% of their monthly income towards rent. Our last priority is for individuals that live in their family home. The referral process for any of the housing resources that DBHDS has to offer is essentially the same. So regardless if the referral is for rental assistance or for a low-income housing tax credit property, a DBHDS referral packet must be submitted by the DD support coordinator or case manager. DBHDS reviews referrals to ensure the individual is in the settlement agreement population. We also need to determine whether or not an individual is able to afford independent living based on the projected budget that is submitted in the referral packet. We review the plan for needed supports in housing, taking into consideration what supports are needed and who will provide the needed supports. We want to ensure that the individual will be healthy and safe in their own home. We also review the referrals for readiness. And when I say readiness, we're looking to make sure that the individual and any other household members have the necessary documents to complete the application process with the housing agency. And those documents include a birth certificate, social security card, photo ID, and proof of income. We also are looking to ensure that the household is an allowable household for the purposes of independent housing. Because remember, I stated earlier during this presentation that individuals that are referred to us are not permitted to live with a parent, grandparent, or guardian. So we will review the referral to ensure that a household member is not a parent, grandparent, or guardian. And last but not least, we like to review the referral to determine whether or not there may be some barriers that might affect someone's ability to move into housing. And the biggest reason we want to look at that is we would like to try and deal with the barrier prior to making the referral to the housing agency. So we will work with the support coordinator and individual to come up with a plan to address the barriers should there be any. Once DBHDS receives the referral, reviews the referral, and approves the referral, we will then forward it to the housing agency in the locality in which the individual would like to live based on availability. Once we've made that referral, then the individual will begin the application and eligibility process with the housing agency. We've covered the resources available to make housing affordable. Now we'll cover DBHDS flexible funding. This resource is a financial resource and was created to offset the cost of transitioning into independent housing. There is up to $5,000 available to cover expenses such as application fees, first month's rent, security and utility deposits, basic startup furniture, household supplies, and it could also be used for assistive technology or environmental modifications not covered by another resource. Flexible funding can be used in conjunction with other sources of assistance. It is not, however, for any purpose related to entertainment. So individuals are not permitted to purchase items such as a television, gaming system, DVD player, radio, etc. It must be used for items that are necessary for an individual to move into and maintain his or her housing. Just like the referral process for a housing resource, flexible funding requests are only accepted by DD support coordinators or case managers. We've talked a lot about how DBHDS can assist individuals with affordable housing. We also want to share information about assistance that we have available for individuals once they're living in independent housing. As with anyone, an emergency can happen when you least expect it. As such, DBHDS has made flexible funding available to help in the event of a housing emergency. There is up to $5,000 available to cover emergencies. These emergencies can include late rent payments where an individual is at risk of being evicted, late utility payments where the utility is at risk of being shut off, unit repairs, or specialized cleanings that are the responsibility of the individual. DD support coordinators will need to submit supporting documentation along with the request for flexible funding to cover any emergency housing expense. The support coordinator will also need to assist the individual with the housing stability plan to address the circumstances that created the housing emergency and come up with a plan to minimize the likeliness that these events will reoccur. I mentioned earlier that DBHDS reviews referrals to ensure that individuals have a plan to receive the supports they need in order to move into and maintain their housing. Now, I will briefly cover where supports in housing come from. Supports in housing can include any of the following: Medicaid waivers, which could be one of the 3 developmental disability waivers, building independence, family and individual support, or community living. Or it could be the Virginia Commonwealth Coordinated Care Plus Medicaid waiver, also known as the CCC Plus waiver. Supports could come from the Medicaid Early and Periodic Screening, Diagnosis, and Treatment, which is for individuals up to the age of 21. Or it could be the Medicaid Mental Health Skill Building. Private pay is another way in which folks can access supports, as well as housemates or live-in aids. Individuals may also tap into local community resources such as Meals on Wheels or house cleaning services, or folks may have a representative payee who assists with paying bills. And last but certainly not least, supports can come naturally, and that would be from family and friends. We've covered a lot of information about the housing resources available to individuals in the settlement agreement population. And you will learn more specific information during the breakout sessions. This slide is simply independent housing resource information to help you learn more about independent housing. You can watch testimonials and read success stories on individuals that have moved from various settings into their own home. You can watch a video that highlights assistive technology that has maximized independence in housing. You could learn about others who are living independently and set up a tour or visit to ask questions one on one. Your support coordinator or regional housing coordinator can assist you with this. You can read about creative ways individuals across the state have moved into housing, either leveraging support for housing or vice versa. Or you could take some time to read through the DBHDS My Own Home Guidebook, which really takes you through the entire process of independent housing. From when you first start thinking about independent housing to creating a budget, being referred for rental assistance, completing the application process, and any other step all the way through lease up. The guidebook also includes important things to consider once you've moved into housing. As mentioned earlier, this slide presentation will be made available to all registered participants in the near future so that you can access the links included and referenced during this session. I introduced our regional housing coordinators at the beginning of this presentation. This map shows each of the areas included in a region and is defined by the colors as shown. Green is Region 1, Western Virginia, and Marie Fraticelli covers this area. Yellow is Region 2, Northern Virginia, and Jeannie Cummins Eisenhower covers this area. Orange is Region 3, Southwestern Virginia, and Anna Bowman covers this area. Gray is Region 4, Central Virginia, and Cherie Hilliard-Jones covers this area. And blue is Region 5, Eastern Virginia, and it's covered by Kim Rogers. This slide is a clean look at the contact information for each of the regional housing coordinators. We've also included information for our housing services manager, Jana Weiner. This concludes the main session of our event. We will filter questions at this time. If you have not already, please type your question into the chat box. We will try to get to as many questions as possible before we transition to the breakout sessions. If we are unable to answer your question during the allotted time, please don't hesitate to reach out to your regional housing coordinator. Thank you for participating in this event.